Hello, I am Philippe Gilchrist, presenting this study on behalf of my team and co-authors, Amanda Thiessen, Barbara Masser, Chris France, Tanya Davison. This study was funded by a partnership grant through Lifeblood Australian Red Cross and Macquarie University. The study is also available as an advanced online publication through Transfusion. So this trial was conducted in Sydney, Australia, and examined to what extent donor fear is associated with various donor outcomes in an Australian sample, and whether this fear can be addressed on site to reduce adverse reactions and improve the donor experience. Fear is quite common among blood donors. Between about 15 and 50% of donors report some level of fear across a number of studies. And despite the level of donor experience, the fear seems to persist. So even about a third of donors with 6 or more prior donations still reported some level of fear in a study by France in 2018. And even about 14% reported moderate to extreme fear at that 6+ prior donations level. So it's remarkable how fear really is present across the donor career. Here's some more data from an unrelated pilot study of 144 Australian donors. So looking at this data here, about half of first-time donors reported at least mild levels of fear. Moving up the number of prior donations, even 1 through 4 prior donations or 5 through 10 prior donations, you're seeing only 61% and 56% reporting no fear. The rest are reporting some level of fear. And for 1 to 4 prior donations, you have 17% reporting very much fear or extreme fear. And at 5 to 10 previous donations, you have 14% reporting very much or extreme levels of fear. So again, fear is present across levels of donor experience, as highlighted through a number of previous studies and examined in samples in Sydney, Australia as well. So fear is prevalent in blood donors. It's important to also note that we can't accurately infer emotions, including fear, based on simply our observations. There's an area of research on this topic in psychology, but suffice it to say that we need to ask in order to know. Even well-trained psychologists aren't that good and have to rely on self-report when trying to gauge emotions, including fear. So we cannot train ourselves or train staff to recognize fear. We have to ask. So self-reported donor fear may predict vasovagal reactions, possibly other reactions I'll get to in a minute, without increasing the risk of such reactions. So having asked the donor about fear doesn't seem to prime further fear or risk for further reactions. And this was evident and discussed in previous studies by Chris France and colleagues. And the authors there also recommend that fear should be assessed during the screening of blood donors to help identify those who could benefit from perhaps anxiety management. So this is sort of leading up to the purpose of our study now. We know donor fears are associated with vasovagal reactions, well established through a number of previous studies. We also know that donor fears are associated with reduced donor intentions. The link between donor fears and other adverse reactions, like venipuncture pain, for example, in the donor experience, is relatively less clear. And these reactions, in turn, may serve as a disincentive to donor return. And this is particularly true for vasovagal reactions, well-established disincentive for donor return. Now, there are various strategies that exist that may be amenable to fear reduction among donors. Though the effect on fear of the blood draw is relatively unknown, and that's because many of these studies were actually conducted as proof of concept studies and in laboratory settings. The effect in a clinical setting is less clear. And many of these studies, although the strategies may be amenable to fear, fear was not always the prime or intended target of the intervention. So there's a clear need for trials to examine how to manage this fear. That's clearly a problem, and especially in real-world settings. It's also well established that staff communicated interventions tend to increase compliance, generally speaking, and increase the perception of an intervention's validity, and ultimately may even lead to greater effectiveness. So this is a general observation from the psychology literature, and it may also be true in the case here when we're delivering intervention to address fears in blood donors. An indication that this might be especially true is based upon some research also by Hansen and France a while back, where they looked at social support from a research assistant, and the presence of the supportive research assistant actually was shown to reduce symptoms of vasovagal reactions among donors. So overall, it remains unclear to what extent fear is associated with various outcomes in an Australian sample, and whether fear can then be addressed once it's assessed in order to reduce adverse reactions and improve the donor experience. This study aimed to address a few questions. Firstly, can donor fear be assessed without inadvertently leading to increased donor apprehension? We hypothesized that assessing fear will not lead to or prime more donor fear anxiety or lead to an increased risk for venipuncture pain or vasovagal reactions. Next, we aim to examine the association between fear and a variety of adverse responses among both whole blood and plasma donors. We hypothesized that fear of the blood draw would be a significant predictor of higher anxiety, venipuncture pain, and vasovagal reactions. We also aim to evaluate the effectiveness of an on-site donor brochure with or without a tailored conversation about the strategies to reduce donor fear, anxiety, venipuncture pain, and vasovagal reactions. And here we hypothesize that providing the instructional brochure would be more effective than no provision of donor information in terms of increasing self-efficacy and these other outcomes. We also hypothesize that engaging with a donor to advise relevant strategies in this conversation would actually result in increased self-efficacy, improved donor experience, increased donor return, reductions in fear, pain, anxiety, and vasovagal reactions. Our trial design included 2 centers in Sydney, so it was a pragmatic parallel group individually randomized trial. We had 664 participants, 539 of which were whole blood donors. All donors were eligible according to the Australian Red Cross lifeblood criteria for donation. They were all 18 plus, and all had 3 or fewer prior donations. And that was an inclusion criterion in order to increase homogeneity in this sample size. So the procedure began with eligible donors being approached by our research assistants. invited to participate, and upon signing informed consent, participants were randomly allocated to one of 4 conditions. This was right after donor registration. So the first condition was a control group where it was donation as usual, followed by the questionnaires at the post-donation refreshment area only. The fear assessment condition was simply the addition of a fear assessment question. So how afraid are you of the blood draw? And it was responded to on a Likert type scale as per previous research. So donors were asked this question on an e-tablet prior to donating. In condition 3, we also included the brochure. So this was the intervention where there was a summary of a variety of evidence-based strategies to manage stress and fear and related reactions among donors. I'll talk a little bit more about the content of this brochure in a moment. Condition 4 now was the same as condition 3, but with the addition of a brief dialogue with a research assistant. And so when a participant indicated some fear, the research assistant then discussed and pointed to appropriate strategies outlined in the accompanying instructional brochure. So that occurred for a total of 1 minute or less, and research assistants were actually trained for 1 hour in total prior to the commencement of the study on how to engage in this dialogue. Condition 4 was designed to demonstrate whether engaging with the donor in follow-up questioning to the brochure and recommending related strategies would provide additional benefit beyond simply providing information, based upon what we know from previous research, as I mentioned earlier, on the importance of staff communication and perceived support. So we had a variety of post-donation questionnaires assessed at the refreshment area. These included the positive support scale. So this assessed felt positive social support. We assessed venipuncture pain on a Likert type scale. We also assessed donor self-efficacy, anxiety and fear, and vasovagal reactions. Satisfaction with donation experience was also assessed on a Likert type single item scale, from 0 to 4 up to very satisfying. And donors also reported finally whether they used the brochure at all or any of the recommended strategies therein. So the brochure focuses on addressing fear and a variety of stress-related adverse responses. So what's included in the brochure? Well, a whole bunch of strategies like distraction, breathing techniques, water loading, AMT, as well as normalizing fear and those symptoms associated with fear, describing what to expect, options available for social support, and addressing possible apprehensions to the procedure overall. This is the brochure. It's a single fold brochure. This is the front page of it here. It's entitled Tips to Help You Relax, and it was developed by the authors in collaboration with Australian Red Cross Lifeblood to address fears and adverse reactions among the donors. So the brochure content is all here. So inside of the single fold brochure, you'll see the content here on the left and the reverse or back side of the brochure, content on the right. So you'll see here that there's a variety of evidence-based strategies to reduce stress-related adverse reactions among donors, including distraction, breathing techniques, other strategies that are normally recommended to donors anyways, like water loading, AMT. We also had added social support. So for example, we wrote, you may tell the staff member conducting the donation today about any of your concerns. Our staff are here to help donors who are worried about needles overcome their fears every day. So statements like that we envisaged could help perceived support. And the brochure was also normalizing fear and the possibility of any negative sensations. So data from our sample here. So about a third reported some level of fear, so 34%, consistent with previous studies. Fear also did not differ across conditions or type of donation. Here in this figure, we see levels of fear as a function of number of previous donations, and similar to previous data discussed earlier in this presentation, you see that fear is relatively stable across the donor career. So the results also indicated that fear led to more reactions. So pre-donation fear predicted higher vasovagal reactions, consistent with previous studies, higher post-donation anxiety, and also higher venipuncture pain. And these effects remain significant even after controlling for previously well-established predictors of vasovagal reactions, like total estimated blood volume. We calculated that through Nadler's formula, controlling for sex and donation experience as well. So this data overall make it clear that the influence of fear is as large and possibly larger than other commonly recognized predictors, like estimated blood volume, sex, donation experience, also consistent with some previous research, mostly by Chris France and colleagues in the USA. So comparing the fear assessment only condition with the control condition confirmed that asking about pre-donation fear did not lead to more post-donation fear, anxiety, venipuncture pain, or self-reported vasovagal reactions. So in other words, assessing fear or asking the donor about fear did not increase risk. This lack of an association here is consistent with previous research in the USA, indicating that asking donors about fear did not inadvertently cause increased apprehension or risk for vasovagal reactions among this sample. So that's important. Also, 89.9% of donors who received the brochure reported having read it, so that's a good sign. And this did not differ between conditions. Of the donors who actually read the brochure, almost all of them reported it was at least somewhat helpful, and 37.9% indicated that it was very helpful. So that was reassuring to see as well. So contrary to our hypotheses, the instructional brochure conditions did not influence self-efficacy, vasovagal reactions, fear, or donor satisfaction. There was a marginal effect, possibly due to sample size when looking at these sort of outcomes, marginal effect on vasovagal reactions where there's more symptoms in the control condition as you'd expect. But again, that was statistical trend only at p.07. So moving on to the exciting results. Given we also found main effects of condition on donor pain and positive support, we proceeded to use the Process SPSS computational tool to examine whether the relationship between condition and lower pain ratings was mediated by higher levels of positive support. So bootstrapping analyses were conducted, and we found significant indirect effects of both the fear assessment and brochure condition and the fear assessment brochure and conversation conditions on pain, and this was mediated by positive support. So this indicated that donors who received the brochure reported less venipuncture pain as a result of perceptions of positive support. So similar results were obtained when we entered donation type, so whole blood versus plasma, as a covariate in these models. So overall, to sum up, donors who received the brochure experienced significantly less venipuncture pain, and this was a result of more positive perceived social support. And this was regardless of whether or not there was that additional 1-minute conversation with the research assistant. So, to our knowledge, this is the first intervention to show significant reduction in perceived pain among donors. So, the venipuncture pain was also associated with increased risk for vasovagal reactions, less satisfaction with the donation experience, and reduced likelihood to return at 6 months. So underlining the clinical significance of this self-reported venipuncture pain. So overall, these findings underline the usefulness of screening for donor fears and the effectiveness of a low-cost strategy to reduce venipuncture pain among donors. So the RA-delivered interventions and sample size were limitations. So we may have had, seen an effect with on vasovagal, more severe reactions like vasovagal reactions or syncope with a larger sample. In terms of the RA-delivered intervention, however, we might expect larger effects if the strategies were delivered by staff. So very keen to see how these strategies may be implemented and how effective they may be when issued by staff. And as I mentioned a moment ago, it's the first study to our knowledge to demonstrate a reduction in venipuncture pain among donors, and this pain seems to be associated with a variety of negative outcomes for these donors. It's also possible that these types of interventions will improve the donor experience, may influence retention, stability of the blood supply, and perhaps even improve session flow by avoiding disruptive and costly adverse reactions. So next steps. So look forward to working together to discover if these or similar materials can be used in donor centers. So be really interested to conduct an implementation trial, maybe to examine more closely perceived support. So the effect is driven through perceived support. So to examine exactly what's going on there. Can these interventions be delivered effectively by staff? We think they might be more effective when delivered by staff, but we still have to find out. Are there barriers to delivery and rolling this out into SOPs? How do we embed this into practice? Do we continue with maybe we could try digital rather than paper form, app-based, for example? How would staff find the integration of this type of intervention into their usual practice? What sort of barriers are there? How can we assist? And questions like what support is needed to move more to more formal implementations. So look forward to engaging with services to answer some of these questions in the future. And thank you very much for your time today and listening to me talk about this study. So thank you to the incredible team of investigators. Really, I feel incredibly lucky to work with such an amazing group of collaborators and co-authors. Thank you, of course, to the donor participants, donor center staff. Thank you for your patience. The research assistants who recruited the participants and entered the data, extended team at Lifeblood, and for the funds from Lifeblood and Macquarie that made the study possible. So thank you.